Hi friends, today we will see reasoning questions and answers on cartilage histology. Why is cartilage considered a specialized connective tissue? Cartilage is specialized tissue because unlike ordinary connective tissue, it has a firm but flexible matrix rich in proteoglycans and collagen fibers, allowing it to resist compression and provides smooth surfaces for joint movement. So these are the cartilages: hyaline, elastic, and fibrocartilages. Why does cartilage not have blood vessels? Cartilage is avascular to maintain its smooth, non-frictional nature and structural uniformity. Nutrients and gases diffuse through the matrix from the surrounding perichondrium. This is the perichondrium here. Vessels would disrupt this uniformity and reduce mechanical efficiency. So in this diagram, there is a cartilage called articular cartilage. The blood vessel is reaching in the bone, it is in the bone, but it does not go with the cartilage. Why do cartilage injuries heal poorly? Due to absence of blood vessels, nutrients reach chondrocytes only by diffusion, a process that is very slow. This limits the cell proliferation and repair capacity of cartilage. So in this diagram, blood vessel is somewhere here and the cartilage is here. So on the periphery, you may see the blood vessel and the cells leave here by a process called diffusion. They get nutrition by process called diffusion. Why are chondrocytes found in lacunae? Chondrocytes secrete matrix around themselves. As the matrix solidifies, it traps the cells in small spaces called as lacunae. There's a lacunae here. This is a matrix here. These protect the cells from compression and maintain cell viability within the dense matrix. This is a chondrocyte lying in the lacunae, and this is the matrix. Why is perichondrium absent in articular cartilage? In joints, the surface must be smooth and allow frictionless movement. Perichondrium would make the surface uneven and limit flexibility. So it's absent in articular cartilage. So this is the articular cartilage which is present at the end of the bones. Why does hyaline cartilage appear glassy under microscope? Because the collagen type 2 fibers are present in it and they are very thin and have the same refractive index as the ground substance. They are not visible individually, giving a glassy appearance. Why is elastic cartilage more flexible than hyaline cartilage? Elastic cartilage contains abundant elastic fibers, as in this diagram, in addition to type 2 collagen. These fibers gives the matrix greater flexibility and resilience, allowing it to return to its shape after bending. Why is fibrocartilage considered a hybrid between cartilage and dense connective tissue? It contains abundant collagen type 1 fibers arranged in parallel bundles like dense connective tissue, along with chondrocytes in lacunae. So here there are a lot of fibers, collagen fibers type 1 and the chondrocytes in between. Why are chondroblasts located near the perichondrium while chondrocytes are lying deeper? Chondroblasts are immature, actively dividing cells derived from perichondrium that produce matrix. Once they become enclosed in it, they mature into chondrocytes and move deeper inside the cartilage. So this is perichondrium. These are the chondroblast. These are the chondrocytes. Perichondrium, chondroblast, and chondrocytes. Why does elastic cartilage never calcify while hyaline cartilage can? Elastic cartilage matrix is rich in elastic fibers, as in this diagram, that resist mineral deposition. Whereas in hyaline cartilage, they can get calcified with the age as calcium salts can deposit in the ground substance. Why do isogenous groups form inside cartilage? They result from a mitotic division of a single chondrocyte within the lacunae. Lacunae is here and a single cell is dividing. Since the daughter cells remain trapped, as in this diagram, close together before secreting new matrix. But as they produce new matrix, they get separated. Why does cartilage matrix stain basophilic in H&E? This is specifically seen in hyaline cartilage. Because the matrix is rich in sulfated licosamino-lichens like chondroitin sulfate and keratin sulfate, which are acidic in nature and that attract basic dye, that's positive dye, hematoxylin, giving it a basophilic appearance, as in this diagram. Why is fibrocartilage found in intervertebral discs and pubic symphysis? These sites experience with compression and tensile forces. Fibrocartilage's dense collagen fibers content provide high tensile strength, whilst cartilage matrix resist compression, ideal for such region. So these are the fibers, and these are the these are the chondrocytes in between the fibers. Why is cartilage more important in fetal skeleton? Most fetal bones are first formed as cartilage models, which are later replaced by bone through endochondral ossification. This allows for rapid growth and flexibility in the developing skeleton. So the hyaline cartilage is converted into a bone. It's called endochondral ossification. Thank you.